Welcome, everyone. So nice to have you here with us. We are offering interpretation for this session. So if you would like interpretation into French, Portuguese, or Spanish, please click the globe at the bottom bar of your Zoom screen and select the language that you'd like to join in. My name is Jenny Miller. I'm the Executive Director of the Global Climate and Health Alliance. Good morning, good afternoon, good evening to all of you. We're very delighted to have you here with us for this opportunity to share with you our forthcoming report, Cradle to Grave, the Health Toll of Fossil Fuels and the Imperative for a Just Transition. Dave Walsh, our press officer, will share a link to the embargoed report and to the press release, the forthcoming press release, in the chat. In addition, we are recording this session, and the recording from this session will be shared within hours of the conclusion of this press briefing. The purpose of this meeting today is to present a brief overview of our report. We'll present an overview and what these findings are leading us to call for. You'll hear from myself and two key authors of the report, Jen Kuhl and Shweta Narayan. Our presentation will run about 30 minutes. Our session as a whole is scheduled for 40 minutes, so we'll have 10 minutes for Q&A, but we're all happy to stay on after that if you have additional questions or want to stay on longer. Next slide, please. So why this report and why now? CO2 emissions reached a new record high last year, a 0.8% increase from the previous year, which of course doesn't sound like much, but this is at a time when we absolutely should be decreasing emissions. We've already seen a year that exceeded 1.5 degrees centigrade. In the health community, those of us in medical care, in public health, we see what's happening to our patients and our communities, but many of these harms are not widely recognized. I think we don't see the full scope and scale of the problem. And in addition, there's some ways in which there are still remaining evidence gaps, and some of the linkages between harms are not being made. The Global Climate and Health Alliance, so that you know who this report is coming from, is an alliance of over 200 organizations. And with our members and our formal partners, we represent 46 million health workers from around the world, from over 125 countries. And we come from the point of view that health is a state of complete physical, mental, and social well-being, not merely the absence of disease. And that definition of health from the World Health Organization underpins some of our work in this report. Next slide, please. So what did we set out to do with this report, with Cradle to Grave? We wanted to wrap our arms around and get an understanding of what are the toxins and pollutants that are produced at each stage of fossil fuel production, from researching sites to extraction, transport, processing, use, and even decommissioning of fossil fuel sites. In addition, we wanted to understand how the human body is impacted by fossil fuel pollution. And then we wanted to take a look at how those risks compound and which communities are most affected and which populations are most effective. I think the thing that this report brings to the table, what this report adds, is that it pulls all of that information together. It looks at the full life cycle of fossil fuels. It looks at every stage of human life from before birth into old age. And it looks at the entire human body and all of the systems and organs within the human body and how they are affected. In addition, as I mentioned before, it takes an integrated approach to health, considering the wide range of harms and how those harms may compound each other. And what we've done, we've not produced new evidence. What we've done is try to wrap our arms around the existing, very robust body of evidence around these harms, but then complement that peer-reviewed evidence with case studies and personal testimonies to kind of paint a richer picture and give a slightly broader understanding of what all of this actually means. In order to ensure that we've gotten this right, we had this report reviewed by 15 experts from across medicine, public health, toxicology, law, public policy, and climate change. So with that, I'm going to turn over to my colleague, Jen Kuhl, who will walk us through some of the findings from the report.
Thanks so much, Jenny. So in collating the research that exists around the health harms of fossil fuels, it becomes very clear that fossil fuels are impacting health negatively from the moment that sites are developed and the fossil fuels are taken out of the ground through to the time that we use them and on through when we're disposing of waste. If we look at the beginning of that cycle at extraction, I think we've long known, for example, about diseases like black lung in coal miners and early death from lung cancer. But those health harms and risks also extend to communities near fossil fuel extraction sites. So coal mining communities are seeing higher rates of lung cancer and asthma and cardiovascular disease. And similarly, oil and gas extraction sites similarly see poor health in those communities. One study that really has stayed with me is this one that looked at children who were born to parents who, when the children were in utero, those parents had lived closer to hydraulic fracturing sites. And those children were twice as likely to develop acute lymphoblastic leukemia in childhood than those children whose parents lived farther away. And that is one of many health impacts of living near one of these extraction sites, which is often not something that people can have a lot of control over. So, you know, they're doing their best to create a healthy life for their families and their children. And then you have a fossil fuel company suddenly make those communities unhealthy communities. Once the fossil fuels are out of the ground, they have to be transported, and that too presents risks, be it pipelines that are leaking. Between 2010 and 2021, there's an estimated gas leak every 40 hours in the US alone. And those leaks are either at risk of causing explosions or of poisoning water systems. More dramatically, through transportation, you have something like the High Bay Spirit oil spill. Cleanup workers from that spill 9 years later were at an increased risk of developing thyroid cancer, simply being the people having been the people who did the cleanup work for something for a massive spill. And then even more dramatically, you have something like the Lac-Mégantic rail disaster in Quebec that killed 47 people. So when we're moving fossil fuels, we're putting those communities along the route of transportation at risk. And then when we use them, fossil fuels are bad for our health. So I think we all have a sense that living near a busy road is a serious health risk, be that of children developing serious asthma or having like impaired neurodevelopment. But it's also bad for adults. Living near a road increases the risk of developing Parkinson's and type 2 diabetes. And in reverse, when we also found some studies that to look at what happens when you get end of type of fossil fuel pollution. So in several places when coal-fired power plants were closed, there was a reduction in asthma visits to the ER, better neurocognitive development, and a reduction in preterm births. So if that's the one thing that's changing, that a fossil fuel power plant that's producing energy is being taken away and you're seeing an improvement in health, that's like a pretty clear indicator that the fossil fuel plant is contributing to poor health. Next slide, please. Fossil fuels also are impacting every part of our body. So that our lungs would be impacted is perhaps obvious in breathing in air pollution, but they impact the entire system. And some of this is due to chemicals that both stay in water and in the land or build up in our bodies. Something like mercury, for example, I think we're familiar with. Those things are being left behind in the environment through the production and use of fossil fuels. and building up in our bodies. There's also a thing that's tricky around measuring the health harms of fossil fuels because some of the worst things may take a long time to develop. So you might be exposed to a fossil fuel in childhood that doesn't show up as a cancer until adolescence. Or you might be living near a road and not develop Parkinson's until 20 years later. And so it's not, because not all risks are immediate, it's hard to know how deeply you personally are being impacted unless you look at it in the grand scheme. I wanted to also highlight heart disease is something that we see again and again throughout the fossil fuel life cycle. So be it living near oil and gas causing more hospitalizations for cardiovascular disease, or traffic-related air pollution being associated with both heart disease and death from heart disease. That's a key organ that we need to keep us alive that's impacted by fossil fuel air pollution. And also throughout this report, you will find evidence of cancer. Obviously, most obviously lung cancer, but mouth cancer, skin cancer, stomach cancer, kidney, thyroid, prostate, bladder, and colon cancer all show up in the evidence that being exposed to different phases of fossil fuels, production, extraction, use, are contributing to cancers. And there's also some evidence about the ways that fossil fuels are changing DNA, which I think really sets up the mechanism. How if a fossil fuel exposure is altering DNA, that's one of the ways that may end up causing a cancer later. So that through line of exposure to harm is evident. Next slide, please. And also wanted to highlight there's key times in our lives where people are more at risk from fossil fuel exposures. One of those being the prenatal period. And I think about, again, parents who are doing everything they can to get ready for a new baby, setting up a crib, expecting, the very best for this new human. And again, the place that they've been living puts that child at risk of things like serious congenital birth defects, including spina bifida, neural tube defects, and oral facial clefts. But also, again, we see leukemia again and again and again from children exposed to extraction, exposed to gas flaring, exposed to traffic. There's this elevation in leukemia. So children and prenatal period and childhood are two key areas of risk. Again, because bodies are growing and all of those exposures, particularly at developmental change points, really increase the risk that something will go awry. And finally, this note that even through to elderly and aging, there is some evidence that exposure to air pollution is contributing to dementia. There is, again, Jenny mentioned data gaps, and they are both geographical, but also adolescence is a key period of development where it's likely that health is being impacted. There's not as much data as we might like about adolescence. So again, we are paying for fossil fuel pollution with our health systems having to take care of people, with families and parents' time, or people caring for loved ones who get sick from fossil fuels, but also in some extremely tragic cases, people are paying with their lives. And with that, I'll turn over to Shweta. Shweta, if you're speaking, we can't hear you.
Oh, I apologize. Thank you, Jen, for taking us through the toxics and human body system and how they are affected and various age and stage in human life. And this is one part of the harm that we have documented in this report. Let's be very, very clear that everyone everywhere is affected by the climate crisis and the fossil fuel crisis. And it's evident from the fact that 99% of people on this planet breathe polluted air. But we have found in our evidence that the heaviest burden falls on socially, economically, and politically marginalized communities. And this is something consistent we found across the evidence that we saw, whether it was developed countries or in developing countries. Most polluting facilities are often sited near people or communities that are socially, economically, and politically marginalized, whether it's in the US, where African American, Hispanic, and working class communities are disproportionately exposed, or whether it's in India, where people from lower caste, lower class are the folks living closest to the places of harm. So this was one thing that we saw consistently throughout our report. Next slide, please. We have, in this report, in addition to the toxins, looked at the social and economic model of the fossil fuel industry, which have very tangible health harms. And the reason, again, going back to the definition of health, which is not just absence of disease, but also your social, physical, and mental well-being, this was important criteria to look at and analyze the impact of fossil fuel industry. Displacement and human rights violation, which are many cases are well documented, where fossil fuel projects have displaced indigenous and local communities. There's land conflicts, and all of this leads to physical and mental health harms and become important indicators. Similarly, there is corruption and weak governance. There are a lot of cases documented about industries' undue influence on governance, on exploiting weak environmental and labor laws, spreading disinformation, and many of these tactics are borrowed from the tobacco playbook, but also exported around the world. So we see fossil fuel disinformation quite prevalent around the world, and there are many cases now, and there are cases in the US of fossil fuel industry being investigated by the US Congress on its disinformation tactics. Similarly, there are examples from Nigeria, Mozambique, and other parts of the world where there are fossil fuel industries have used repression to communities opposing fossil fuel infrastructure and using the state machinery against communities. And the reason why we're documenting all of these harms is to, again, showcase the physical and mental health impacts of the fossil fuel industry and its social and economic models. Similarly, you will see social and economic disruption caused by fossil fuel industry. We often see, and there are case studies documented in this report about promises of job, which have often given way to substance abuse, violence, economic instability, trafficking, and sexual violence, particularly among women, and rising mental health crises. We have testimonies from indigenous leadership in the US who have given examples of increased sexual violence in US pipeline areas because of man camps. So there are plenty of data sets that we have explored in this report that gives us an indication of the social harm that fossil fuel industry is causing. Next slide, please. Now, this was something unique that we captured in our report, which was that, we have, and this is something in the last 2 decades we are seeing increasingly, that fossil fuels are not only driving the climate crisis, but also multiplies risks when disasters strike. Most of the fossil fuel infrastructure around the world are built in low-lying coastal areas that are, and regions especially prone to floods, cyclones, hurricanes. And this is the 20th year of Hurricane Katrina. And we have seen the impact and devastation caused by the hurricane, not only in disruption of community and various services, but also the oil spills that happened 20 years ago and the toxic legacy that those communities continue to bear. We have seen similar cases of oil spills, excessive emissions during cyclones and flooding in South Asia and Southeast Asia, and some of them are documented in this report. We've also seen that as these extreme weather events fueled by fossil fuels harm communities by making the fossil fuel infrastructure vulnerable, they also disrupt hospital, health services, and clinics and make them inaccessible, especially in times when people need them the most. So effectively, fossil fuels create a double burden, causing the crisis and then magnifying its health impact during the crisis, especially in fence line regions. Next slide, please. One of the reasons why we wanted to look at the various pillars of harm was also to understand how climate policies are working. And most climate policies focus narrowly on carbon and methane. While it's critical, it overlooks the broader social, ecological, and toxic health harms of fossil fuels. And that's what we're trying to showcase in this report. And when the lens of climate policy is too narrow, we end up with fantasy solutions like carbon capture and storage, technologies that have failed to deliver. And even if they worked perfectly, the toxic pollution, the community disruption, and human rights abuses from fossil fuel would persist. So they're not solutions in many ways. And this is why our report brings together the full spectrum of harm. When we are talking about just transition, this conversation cannot be reduced to jobs versus jobs or energy sources alone. It must address historical injustices, protect human rights, indigenous rights, and ensure a right to clean and healthy environment and right to health. Communities suffering from long-lasting health impacts will need long-term health care for those impacts. A just transition conversation that is holistic in nature, that includes the health harms of fossil fuels, will be able to address all of that. And this evidence presented in this report here reframes that conversation, that debate, and makes it clear that processes and accountability need to deliver it. Next slide, please. This is just an example of different kind of testimonies that we have produced in this report. We have frontline communities, doctors, nurses, and community health workers from different countries, India, South Africa, Chile, Indonesia, USA, UK, Mozambique, Australia, and Malaysia, who have presented their lived experience either as residents around fossil fuel infrastructure or around as healthcare professionals and healthcare workers serving in those communities, giving their own experience of what kind of harms that they're seeing. Next slide. And with all of this data, we have looked at what are the recommendations, what can be the way forward. And we can, I mean, there are 8 recommendations in the report that can broadly be clubbed into 4 categories. The most immediate and urgent one is stopping expansion of existing facilities or new exploration and development. Then we are looking at, because we are looking at the finances, it's important to understand that the subsidies, direct and indirect, must be stopped and diverted towards investments in health, investments in achieving sustainable development goals. We also really need to restructure the fossil fuel finance structures to align them to and align global institutions with climate goals. The third pocket of recommendations are about accountability and cleanup of the contaminated sites. And because the evidence is so strong on the toxic pollution, this recommendation becomes really, really important. It means cleanup of existing fossil fuel production sites, making sure that in terms of accountability, the polluter pays. The polluter is fully responsible for compensating for environmental and health damages, and as well as cleanup, and ensure that the ability of fossil fuel industry to create disinformation, to create misleading information that delays climate action is curbed and handled. And then final pocket of recommendations are about the need to have more community-led health research and local action that benefits the community, that involves the community, that is transparent, and that is respectful of people's right to clean and healthy environment. And particularly for the health sector, it's important to for them to lead this change, to understand what kind of situation they really need to make themselves in the future in the low carbon economy. How are they fit for purpose? How are they providing care and cure? And how the health community can lead the change on tackling the fossil fuel industry. With that, I will hand over to Jenny to talk about recommendations for COP30.
Yes, thank you so much, Shweta. And with COP30 coming up in just a couple of months in Belém, Brazil, we have some clear opportunities to advance action that would tackle some of the problem that we're speaking about here today. The first and foremost is for the countries participating in COP and negotiators at the table there to set clear targets fossil fuels. We need to make that measurable and accountable by having countries commit to measurable action, agree to timelines, set targets, and fully commit to that full transition to clean energy that is accessible and affordable for everyone. We know that many communities don't even have the access to energy that they need. That energy access must be expanded, and it's got to be done with clean energy. In addition, there'll be a big focus on the Just Transition Work Program this year at COP. At COP30, countries will be looking at the principles and adopting principles to underpin the work of just transition. And we need to make sure that those principles go beyond, as Shweta was saying, and Jen was saying as well, a mere job-to-job transition, getting fossil fuel workers into non-fossil fuel jobs, but instead really consider the impacted communities that will be affected by the loss of fossil fuel jobs and energy. And the long-term impacts that they may have from having been exposed and the kinds of supports that they're going to need over time. Finally, we've seen since the Paris Agreement just an explosion of fossil fuel lobbyists at COP, attending the talks, even on delegations, in the COP presidency in some cases. Folks that had been industry actors and industry leaders. That's got to stop. With fossil fuel lobbyists and fossil fuel industry at the table, that presents a clear conflict of interest, and we're not going to get the policies we need to move out of the fossil fuel era and into a clean energy future. And part of that work has to be the work of ensuring that the communications firms representing the COP are not communications firms that are also simultaneously representing the fossil fuel industry in order to protect that information integrity and prevent disinformation around these issues. So this report is embargoed until September 16th. On the 16th, we will have a online public launch of the event. We're really excited about this event. We've enlisted some quite notable speakers to join us in talking about the health impacts of fossil fuels and thinking about what the implications are of the findings of this report. We hope you'll join us. And do please respect the embargo in terms of writing about this report until the embargo date on the 16th. And then following this this press briefing, myself and Shweta and Jen, the other authors of the report, are happy to take interviews. In order to set something up, please contact Dave, and he will make that happen. And with that, I would now like to open the session up for questions. We're happy to have you post questions in the Q&A. We also have some questions that have been coming in through the chat. And I will take a couple of those that showed up in the chat. I believe the full names and titles of the speakers has already been shared in the chat and should be in the press release as well. Also, there was a question about whether this report covers just the US or the world at large. That was also addressed, but I'll respond to that as well, that this report is looking globally at the problem. And when you look globally, the scope and the scale of the impacts of fossil fuels is simply overwhelming, and really warrants kind of an urgent and immediate response. So taking a look at one of the questions in the Q&A, maybe I'll direct this to Jen. Does the absence of new data lessen the effectiveness of such a global or sweeping report? Actually, I think a couple of us could respond to this. So does the absence of data lessen the effectiveness of such a global or sweeping report? Jen, do you want to take an initial pass at that? And then maybe Shweta might wish to weigh in as well.
I don't think so. I think when individual studies come out about harms to individual communities, or we hear about, one disastrous spill, that I think makes it seem like a small local problem that is passing. And I think if you bring it all into view and you hear all of these stories of children and families and communities who are being impacted, and you can see that that's aligned with health research data, for me, it is actually the scope. It's bringing all of this information together in the same place for the first time that I think is what makes it feel impactful, because we hear these stories all the time, but to see them in one place, I think is quite powerful in beginning to illustrate the scale of the problem.
Yes, and just to add to what Jen said, I would like to also mention that the data itself is scarce, not because there's no interest in research, because of industry influence, and because sometimes there is interest in not exposing that data. And that doesn't mean that there is an absence of problem. And just looking at the experiences, for example, from Nigeria, the fact that in one of the most recent studies that looked at presence of toxic chemicals in women's bloods and body, found that 12,000 samples that were taken from Niger Delta among women, and their bloods, each and every sample showed presence of polyaromatic hydrocarbon. Now, that's recent, but that's just an example of the kind of prevalence of problem that we see. And that's why in this report, what we have done is that we've looked at the existing data, but wherever there are data gaps, we've also looked at personal testimonies and the testimonies of healthcare workers, because they're seeing the impact in their clinics, in their communities in a real time. And that's important to highlight. And again, as Jen said, once you start collating all of this data and look at across the world what's happening, you'll see the enormity of the challenge before us and enormity of the problem that we're facing.
Thank you both. Next question. You've called for banning fossil fuel ads and barring fossil fuel representatives at COPs and other climate conferences. Is this the first time you've called for that as a collective? The recommendations, at the end of this report, the key recommendations, and as well, a couple of the things that we're calling for with respect to this COP, it's not new. And that's one of the shocking things, really, is that we've known that we need to take these steps of phasing out fossil fuels. The part of the reason we developed this report is that it was clear to us that the full breadth and depth and scale of the impacts of fossil fuels were not landing. We're not making the change that we need to see made. And some of that is because the conversation remains narrowed around CO2 emissions. In the context of COPs, there's a discussion of CO2 emissions and addressing climate change. And sometimes as a health community, we've made the mistake of talking about the co-benefits of taking climate action, but not really spelled out what are those co-benefits. What we've done here is sort of looked at, well, what are the health harms that fossil fuels are creating? Because removing those harms are the co-benefits that we've been talking about. But we've not spelled that out. And in creating this report and developing this report, we really wanted to pull together that evidence about the health harms of fossil fuels all in one place so that people could really have it land just how significant this problem is. So let me take a next question. Related to the question of absence of data, to what extent do geographic data gaps exist regarding the health impacts of fossil fuels in the global south? Jen, over to you.
Yeah, I would say there's major data gaps in relation to the impact of fossil fuels in the global south. Partially, there are broad health data gaps in the global south. We know the research dollars are in wealthy global north countries in North America and in Europe. So that gap exists in health data broadly, but I think it's more exaggerated. It felt more exaggerated here because we know places like the Niger Delta and Ecuador have seen fossil fuel extraction. We hear stories of health being significantly impacted, but the studies are not there. And I think that may be partially due to how research funding works. I think it may also be due to how challenging and unsafe it is to do research in those environments, where we know that fossil fuel sites in some regions are highly controlled by military-like forces, and that it's dangerous to go talking to communities about how their health has been impacted. It's dangerous to be a researcher speaking out. So I think that there are a number of reasons that we're not seeing that data from places in the global south. But given what we are seeing from the global north, I can't imagine the health impacts would be any different. Bodies are the same. They're impacted by toxic chemicals in the same way. The fact that the data is not there does not mean that the health impacts are not there. It just means that we need more research.
Yeah, Shweta.
And just to add and build on what Jen said, in fact, in Global South, the access to care, the access to some of the looking at some of the mitigation on health impacts is lesser. And because of marginalization, because of impoverishment, we have seen many cases where people don't even report health problems until it becomes a matter of life and death, because there's a choice between seeking healthcare and ensuring that you have your daily wage to support your families. So the conditions, the social, economic, political conditions are much more constrained. That adds to the added burden of no data, despite the lived experience of people. And just also on the previous comment on whether this is the first time there is a call to a fossil fuel ad ban. And as Jen and Jenny said, no. But then this is the first time that we are seeing enormous amount of health evidence backing that global call on fossil fuel ad ban. There is not just a social and a moral case, but there's also a medical and a health case to be made on why we need to curb fossil fuel industry's disinformation and influence and its methods of shaping its own perception in society.
Thanks, Shweta. Thanks, Jen. There's a question about how are you leveraging these 46 million health workers you mentioned that you represent? And I'll make a comment and then see whether Shweta or Jen wants to add on it. So the health community has been increasingly becoming more vocal about this. Ahead of COP28, there was a letter from leading representatives of leading health organizations from a number of places in the world, really emphasizing that fossil fuels must be phased out in order to protect health. Prior to that, the health community came together around support for the call for a fossil fuel non-proliferation treaty to stop the production of fossil fuels. And in fact, in that instance, the World Health Organization also endorsed that call. The health community has been stepping up in moments to call for the phase out of fossil fuels. At the same time, I think even those of us within the health community are still learning about the scale of this problem. I feel like as we did this report, we learned much more about how pervasive the impacts are, the communities that are being impacted, the reach of the problem, the toxicity of the pollutants that are coming from fossil fuels, and the fact that this is happening all across the production cycle of fossil fuels. So there's a lot that the health community itself can learn about the scope and scale of the problem. And one of the intentions of this report is to make that evidence base really available to the health community to support its efforts to speak to this issue in meaningful ways. Jen or Shweta, anything you wish to add there?
Just
Okay.
a quick this thing in
Yeah.
sorry, in the list of actions that health community is already taking, I think most recent is challenging fossil fuel disinformation by the health, more than 75 health organizations from around the world have now committed to fossil-free communications through a Break the Fossil Influence campaign, where they're challenging the PR and ad agencies that are associated or committing not to work with PR and ad agencies associated with fossil fuel industry. And I think that's one of the steps, even on social norms and disinformation, that health community is taking action. And as you said, Jenny, there's so much to learn and so much to build from this report for the health community to be informed and be strategic in its intervention.
Yeah. Yeah. And that Break the Fossil Influence campaign for the health community, that actually is really new. We launched that campaign in May of this year, and it's really gaining momentum. Health organizations are indeed seeing that it is that working with agencies that support fossil fuel disinformation and support fossil fuel greenwashing and promotion of these unhealthy products is just simply incompatible with their mission as health organizations. Okay, a question here from Daniela in Brazil. COP30 presidency is inviting CEOs of oil and gas companies to discuss the transition. What do you think about that? Shweta, do you want to start us off here?
I think with this evidence over here, I think it will be important for COP30 presidency to look at the scale and scope. And I think one of the key recommendations that we have produced in the report, which is of accountability. When we discuss transition, if it is going to be just, it means that the people who are responsible for the problem are held accountable. Accountable not just in terms of cleaning up the pollution, but also compensating communities for the harm that they have caused, both physical, mental, and environmental harm. And that's key. So any conversation that does not include accountability, that it does not include looking at justice for the most marginalized, most affected people, for the indigenous people, is, in my opinion, not a just transition. So our focus would be to build and inform the presidency to ensure that accountability is core in the conversations around just transitions with any stakeholder.
I'm not currently seeing, oh, wait, sorry. There is another question. Great. You showed the problem. There's no data available. You showed the problem. There are no data available in support of that. Do you have any solution for industries to replace fossil fuels? According to you, how long will it take to change the situation? I'm not 100% sure I understand this question, but let me take a crack at it, and Shweta, maybe you can take a crack at it as well. So, solution for replacement of fossil fuels. What we are seeing at this time is that the price of solar is dropping. The technical capacity of solar to provide power and to provide reliable power is increasing. There are other renewable technologies that are also increasingly effective. And in terms of expanding energy access, providing resilient access to energy in places where electricity can be a bit sketchy, transitioning to small grids of solar power or localized solar power really is a resilience solution. One of the problems that we have right now is currently the fossil fuel industry is being propped up with $1.3 trillion of public subsidies. That's direct subsidies to make it cheaper, easier, and more possible for people to get fossil fuel based energy of various kinds than alternatives. Those funds redirected into developing clean energy would be transformational. So I think the potential for that transition is already very, very evident. The problem right now is, the scales are tipped in favor of continuing fossil fuels. Shweta, anything you want to add to that?
Yes, and I just also want to address this framing. I think fossil fuel industry has been around for over 200 years, and yet we have energy poverty. It's very real. Billions still lack access to reliable, safe, and affordable energy. And what this report makes definitely very clear that fossil fuels are not the solution. The communities, the fence line communities, communities living near coal plants, oil refineries, or a gas infrastructure face both energy poverty and health crisis in terms of pollution, in terms of health harms. And we've seen this, and especially I can speak from my experience in India. Communities residing cities around coal mines and power plants have the highest amount of load shedding, despite the fact that the power is being generated in their backyard and it's all being exported to big cities. What definitely, and again, building on and reiterating what Jenny said, that renewable energy is at this point among the cheapest, among the most accessible. It can be deployed in a decentralized manner and can provide energy which is necessary for healthcare, for overall development of communities. And when the options are right there, which are cheaper, cleaner, accessible, and provide health, why should we opt for fossil fuel energy?
And Jen, you wanted to come in.
Yeah, 2 points. One is an anecdote from colleagues at MSF who talked about in Nigeria, the Nigerian team found it so much more reliable to use solar power to power their clinics because they didn't have to worry about getting fuel in to run the generators. And that's something we've heard in Sierra from health workers in Sierra Leone as well, that having solar is actually more reliable healthcare in addition to protecting health by not being polluting. And the other thing I wanted to say in terms of transition is, in my mind, there's just absolutely no way we should be building any more coal-fired power plants. They're so damaging to people's health. They're damaging, for the whole community nearby that power plant, that you are suddenly at risk of respiratory disease and cancer. So one question is moving away from the power plants that already exist, but absolutely we should stop. It would be, yeah, one easy move. I recognize not easy grandly, but if we're putting in new major electrical projects, there's no reason to make them coal-fired power plants.
Shweta, you wanted to come back in?
Yes, and also, and I think, and as a campaigner, I like to repeat things. So Jen has already mentioned this. When you look at the toxics harm, please remember that these toxics stay in the environment for decades and they continue harm. So the harm is not just immediate. And that means we're talking about generations of people harmed by these chemicals. So in terms of the time scale, it's absolutely important to see, again, with fossil fuel infrastructure, that even if the infrastructure is shut, if they're not scientifically remediated and cleaned up, those facilities, those spaces have the capacity to harm people for years to come. And that means increased health burden, increased health cost, and increased need for healthcare. And all of that means cost. and somebody will be paying that cost. So in terms of solutions, we have to keep all of this vast spectrum of harm in mind when we're designing solution. And again, all roads lead to clean, decentralized, renewable energy infrastructure to power communities and ensure their health and well-being.
So the Mithilesh came back in and said, Shweta, you clarified my question well. In spite of that question, as it is being said that solar energy is clean energy, is there any research that says it has no reverse impact on the health of people or our environment? So this is really a question about how we proceed into this next energy era in a way that is responsible. And Jen and Shweta, I know you both have points to make about that, and sort of the critical mineral mining issue and that sort of thing. So Shweta, do you want to go first, and then Jen, you can come in?
Yes, and again, I don't think that clean energy is not inherently just. And I think what in our report we have showcased the behavior of the fossil fuel industry, their social and economic models, which lead to injustices. And if that same model is repeated in a clean energy situation, we will not have justice. And I think what we really need to dig down and look at the report is the patterns of harms, the patterns of injustices. And in order to replace the fossil fuel infrastructure with clean energy, we really must not repeat those patterns of injustices. That means people's consent, participation, transparency, accountability, respecting indigenous people's land rights, pre and prior informed consent. All of that goes into defining whether the clean energy will be truly good for health and environment. If those patterns are repeated, as I said, that will not guarantee a healthy and a clean environment. And that is my core message as we look at this report. And we have established the pattern, we have looked at the harms from that pattern, and our core message is not to repeat this pattern.
And Jen, in your look at the evidence, anything to add about this kind of concern about critical mineral mining, and how do, is it possible to do that in healthy, safe ways that protect people's health, workers' health, and community health?
Yeah, I didn't look specifically at protecting people's health around critical mineral extraction. And I think that we certainly have heard that there are places in the world where critical mineral mining is harming health and the environment and putting people's lives at risk. And I think that means that our responsibility globally is to figure out how do we do that mining in a way that is not polluting communities, is not trampling indigenous rights, is protecting people's health. I want to believe with the technology that we have today that those minerals that we need for for our energy future can be extracted in a way that doesn't harm health or the environment. But that is on us collectively to figure out how we do that and to push for stronger regulations and stronger protections for communities and places where those minerals are coming from. I don't think the answer is to say fossil fuels are bad and critical minerals are bad, therefore let's go with fossil fuels. I think the answer is like, how do we pursue renewable energy in a way that does not cause health or environmental harm?
And certainly the scale of harms that we are seeing with fossil fuels really require us to take seriously that responsibility. There's another question here. I've read that the accessibility to energy is also linked to poverty level, because for people who lived below the poverty level, access to fossil fuels have, in a way, improved their life's quality in the short term. In the 90s in China and later in India, if I remember correctly. How do you address this paradox? I think the first part of a response that I would make to that is, there was a time when fossil fuels were an important part of development. We didn't know at the time the costs of that. We now know the costs of that, and we now have alternatives. Energy poverty is linked to poverty. People do need access to energy to be able to go to school, to be able to run small businesses, to be able to access healthcare, all of these kinds of things, to have cleaner cooking. All of these things are vitally important to people's health and well-being and their development and their movement out of poverty. Absolutely. During the fossil fuel era, there were not clear alternatives to provide that energy in a clean and safe way. What our report shows is that globally, we've paid a tremendous price for that development. What we also know now is that we have other alternatives. That development can happen without paying that health cost and that terrible toll that fossil fuels have imposed. Anything to add from either of you?
I think, just by way of example, women who are cooking indoors using coal or using kerosene are exposed to pollutants that shorten their lives, that give them asthma, that may give them cancer. And I think that it strikes me as a deep injustice that the only solution we can come up with for people living in poverty is something that is slowly poisoning them. I think, again, there's a global impetus on all of us to make clean energy accessible to people. And I believe that it's possible. It's a matter of political will. Yeah.
Great, great concluding. Oh, Shweta, yeah.
Sorry, no, I mean, I was just thinking about the examples, rightfully about China and India, but the fact still remains that India has some of the worst air quality in the world, and that's a direct impact of burning of fossil fuels, and the harm in terms of health harms that we are seeing. We are not counting that cost, and if we start accounting for that cost, I don't think there would be any doubt left in anybody's mind that clean energy is the way to go forward.
So great closing thoughts from both of you. Thank you very much. I'm going to wrap us up here. For those who would like to speak further with Jen or Shweta or myself about this report, please contact Dave Walsh and he will make the arrangements. As noted earlier, after this press briefing, we will send around the video from this briefing. We will also reshare the embargoed report and the press release. Just a reminder that the embargo is for September 16th, and reiterating that we'd love to invite you to join us for the global launch of this report for our online event on the 16th. We'll put the registration link for that in the email that follows this session as well. Thank you, everybody, for joining us. We're really thrilled to have you be interested in this issue, and hope that you'll help get the word out about this problem, and by sharing stories and doing stories about this issue. So we appreciate your attention, and look forward to talking to any of you who would like to talk with us further. Thanks. And with that, we'll close the session.